Welcome to Kind of Beautiful with board-certified plastic surgeon Dr. Tracy Pfeifer, the podcast for women seeking the very best of modern beauty.
So, a plastic surgeon specializing in aesthetic surgery. I've been in practice for about 22 years. I started my journey in medicine always knowing that I wanted to be a surgeon from the time I was a little child. No, I really have no idea where it came from. My father tells me from the time I was 6 years old, I said I wanted to be a doctor and a surgeon, and nobody really knows where it came from. I had a great uncle who was an anesthesiologist, but I did not know him. I have no close family members in the medical field whatsoever. I always wanted to help people. So I do remember that. So in plastic surgery, interpersonal communication is, I think, very important because you want the patient to feel heard and you want to really have a clear understanding of what their goals are. So that requires, pretty good communication skills. I love any breast procedure, breast augmentation, reduction, lift, revision of augmentation, correction of capsular contracture. I just love that. It's very creative. Every patient is different, so every solution is different. It's not cookie cutter at all. And breast reductions, I would say, are the most rewarding because it has the most dramatic impact on the patient's life in terms of their physical feeling, that they don't have pain anymore in their shoulders and neck and back, but also they just have less self-consciousness. They feel more confident in their clothes. But it's true of all patients of all ages. It doesn't matter if you're 20, 40, 60, even 70. It is a life-changing operation. Overall, COVID was horrible, but in addition to becoming more educated, it also opened up, options for patients in terms of office visits. They could do a Zoom consult or they could come in person. We usually take about an hour either way. No matter what the procedure is, I like people to really understand, what's involved and sort of the pros and cons. And so there's a lot to go over with patients. And I think we do a very good job of that because I really do spend the time with them on it. And I think other offices, it's like 20 minutes in and, that's it. You can't explain everything in 20 minutes. And that's one of the things that I'm hoping to achieve with our podcast series is to give another way for people to find out the information so they could pop it on in the car or listen to it because it's a lot of information that I give during the consultations and you can't really keep track of all of it, especially if it's the first time you've heard it. So it's nice for the patients to either listen to the podcast about, for example, let's say capsular contracture that can happen with breast implants or how do we pick the right size and listen to that either before the appointment and or after the appointment. And I think you can absorb more information that way. Hearing it just one time, I don't know how much you can absorb, maybe 60%. So our team has been in place for a long time and I'm very grateful for that. They're terrific. The patients love them. They love taking care of patients and we're all on the same page when it comes to our culture in the office with regards to how we treat and respect our patients.
To learn more, go to kindofbeautifulpodcast.com or follow Dr. Pfeifer on Instagram at Dr. Tracy Pfeifer, spelled Pfeifer. Links to learn more about Dr. Pfeifer and anything else mentioned on today's show are available in the show notes. The Kind of Beautiful podcast is a production of The Axis, THEAXIS.io.